Okay, ready to dive in. Today, we are looking into chronic obstructive pulmonary disease, COPD. You've probably heard of it, but we've got some interesting research here that explores it from both a modern medicine perspective and through the lens of Ayurveda.
Yeah, this should be a good one. COPD is it's a pretty big deal globally, actually. Fourth leading cause of death worldwide. And the numbers are going up, which is concerning.
Yeah, it's definitely something to be aware of, and our research today focuses specifically on India, where it's the second most common lung disorder, right after tuberculosis.
Right.
So pretty prevalent there, and it affects people whether they live in cities or rural areas, men and women, though statistically it does seem to be more common in middle-aged and older folks, and men slightly more than women, but the point is it's widespread.
Yeah, absolutely.
So today, we're going to try to break down COPD, look at it from these two different systems, modern medicine and Ayurveda, see what they say about what causes it, what it looks like, and how to manage it.
And maybe even prevent it.
Yeah, hopefully even prevent it. And we'll try to do it without getting too technical, give you the key takeaways in a way that's easy to understand.
That's the goal.
So where should we start? Let's start with the basics. What exactly is COPD? What's going on in the body when someone has it?
All right, so from a modern medical perspective, COPD basically means you have trouble breathing out, airflow limitation. And it doesn't really get better, even with medication. It's an umbrella term that covers things like chronic bronchitis and emphysema.
Okay, so two separate but related conditions.
Right. So chronic bronchitis is when you have a cough that just won't quit, produces phlegm, that mucus you cough up. And this goes on for at least 3 months every year, for at least 2 years in a row.
Wow, that sounds miserable.
It can be. Then you've got emphysema, which is it's when those tiny air sacs in your lungs, the alveoli, they get damaged and enlarged. And it's permanent. So the lungs lose their elasticity, and it makes it hard to breathe.
So basically, the lungs are struggling to do their job.
Ex-
Okay, so that's the modern view. Now, what about Ayurveda? How does that system understand COPD?
So Ayurveda looks at it as a disorder of what they call the Pranavaha Srotodushti, which is basically the whole respiratory system. And the article we're looking at today points out that what Ayurveda describes as Pranavaha Srotodushti, that's an imbalance in the respiratory system, it actually lines up pretty closely with how we understand COPD today.
Interesting. So they were already describing something very similar centuries ago.
Yeah, seems that way. And they often link these respiratory problems to a history of what they call kasa, which is just cough, or tamakashvasa, a particular type of breathing difficulty.
Okay, so the idea is that these long-standing respiratory issues can develop into something more serious, like COPD.
Yeah, that's the general idea.
Makes sense. So let's talk about causes. Why do people get COPD in the first place? I mean, modern medicine tells us it's things like air pollution,
Right.
secondhand smoke, occupational hazards like dust and chemicals,
Mm-hmm.
and obviously smoking itself is a huge factor. Oh, and cold weather can make it worse.
Yep, all of those are recognized triggers.
Now, Ayurveda has a pretty long list of potential causes, too. Let me see if I can remember some of them. Diet is a big one, eating too much of certain foods.
Yeah, they specifically mention things like kidney beans, black gram oil, sesame oil, white flour preparations, tubers,
Tubers.
like potatoes and yams, things like that.
Okay. What else?
Curd, unboiled milk, certain types of meat, particularly aquatic or marshy meat.
Interesting. Is there a common thread there?
Well, the article suggests that these are all foods that are considered difficult to digest. They can lead to indigestion, which.
Might affect the lungs somehow.
Yeah, exactly. It makes you think about the gut-lung connection. Modern science is finding more and more evidence for how those two systems influence each other,
It's amazing how much we're learning about the interconnectedness of the body.
isn't it? And Ayurveda was onto that a long time ago.
So it's not just what you eat, but how you eat, too.
Right. Ayurveda emphasizes regular, timely meals. They call it vishamashana if you eat irregularly.
Makes sense. What else is on their list of causes?
Well, exposure to dust, fumes, smoke, that's similar to the modern view. But they also talk about strong winds,
Interesting.
living in cold environments, using cold water, either too little or too much physical activity.
So basically, extremes of any kind.
That seems to be the idea. They also mention daytime sleep and having irregular sleep patterns, even physical injury to certain parts of the body.
Wow, so they really take a broad view of what can affect respiratory health.
They do.
But, even though the language is different, there's a lot of overlap with modern medicine. Both recognize environmental pollutants and the importance of things like sleep and physical activity, though Ayurveda seems more focused on finding a balance in all those areas.
Yeah, that's a key principle in Ayurveda, everything in moderation, finding that middle path.
Okay, so we've talked about what COPD is and what might cause it. How does it actually develop? What's the process?
Well, modern medicine explains it as a cascade of events triggered by those inhaled toxins. especially cigarette smoke.
Right, that's the biggest culprit.
Definitely. So the smoke irritates the airways, causes inflammation.
Inflammation is kind of the root of all evil, isn't it?
Often, yeah. So this inflammation causes the mucus-producing glands to get bigger, and you have more goblet cells. Those are the cells that make mucus.
Right.
But at the same time, the cilia, those little hair-like structures that help sweep the mucus out, they become less effective. So you have more mucus and less clearance.
Bad combination.
Yeah, it leads to blockage, and the lungs lose their elasticity. And eventually, you end up with COPD.
Okay, that's a pretty clear picture of that it happens. Now, how does Ayurveda explain the same process?
Their explanation focuses on the concept of vital energies, prana and udana vayu. These are like, not physical substances, but energies that govern respiration.
Okay, so they're more like functional forces.
Right. And when these energies are disrupted by the causes we talked about, it leads to an imbalance in the Pranavaha Srotodushti.
The respiratory system.
Right. And this imbalance causes kapha to increase. Kapha is one of the 3 doshas in Ayurveda.
Those are the fundamental energies or principles that govern the body, right?
Exactly. And kapha is associated with things like structure, lubrication, and it often manifests as mucus.
So too much kapha means too much mucus.
Right. And that mucus blocks the airways, just like in the modern explanation.
So they both end up at the same place. One talks about inflammation and structural changes, and the other talks about vital energies and doshas. But the result is the same, obstructed airways.
That's right. The language is different, but the underlying process is remarkably similar.
It's fascinating how these two systems, developed so far apart in time and culture, can arrive at similar understandings of the body.
I agree. It really highlights that there's often more than one way to look at things, and different systems can complement each other.
Absolutely. Okay, let's move on to symptoms. What does COPD actually look like? What are the signs that someone might have it?
From a body perspective, the classic symptom is a chronic cough that produces phlegm, sputum as it's medically called, and shortness of breath, particularly with activity, especially if there's a history of heavy smoking.
Right, those are the big red flags.
Yeah. And as the condition worsens, you might see things like wheezing, a tight feeling in the chest, frequent respiratory infections, and even difficulty breathing at rest.
Dyspnea, right.
Yes. And in severe cases, there can be swelling in the legs and ankles. It's called peripheral edema, and it's usually a sign of strain on the heart. You might also see cyanosis. That's a bluish tint to the skin or lips because the body's not getting enough oxygen.
Okay, those are serious signs.
They are. And a doctor would also be listening for certain sounds when they examine the lungs. Crockles, raunchy. These are abnormal breath sounds that indicate problems in the airways.
Right, so a lot of different ways COPD can manifest.
Now, Ayurveda describes the symptoms a bit differently. They talk about things like adasristam atibadoma, which means the breathing is either too fast or too restricted.
Okay.
Kupita, which means the breathing pattern is disturbed. Alpa alpam, meaning shallow or frequent breaths. And Sachpadam Sashulam, which means the breathing is noisy and painful.
Wow, those are some descriptive terms.
Aren't they? And you can see how they correspond to the modern symptoms. Restricted breathing, disturbed pattern, that's like shortness of breath and dyspnea. Noisy breathing is wheezing. And painful breathing, well, that could be chest tightness or discomfort.
It's almost a direct translation, just different language.
Yeah, pretty much. And the article also specifically describes how emphysema might present from an Ayurvedic perspective. They mention a long history of breathlessness on exertion, but minimal coughing, maybe just thin, clear mucus, a tendency toward a thinner body build, prolonged exhalation, often with pursed lips, and possibly those crackling sounds in the lower lungs.
Again, pretty similar to the modern picture.
Very similar.
So even though the frameworks are different, both systems are essentially describing the same experience. It's just a matter of how they interpret it.
Exactly.
Okay, so we've talked about causes and symptoms. How do you actually know if someone has COPD? How is it diagnosed?
Well, in modern medicine, the gold standard is a pulmonary function test, specifically a spirometry test. It measures how much air you can forcefully breathe out in 1 second. That's called FEV1.
Okay.
And they compare that to your total lung capacity. If the ratio is low, even after using a bronchodilator to open up the airways, it pretty much confirms COPD.
So it's a very objective measurement.
It is. They might also do a chest x-ray, but that's more to rule out other lung problems. It might not always show clear signs of COPD, especially early on.
Okay, makes sense. Now, does Ayurveda have a similar test?
Not exactly. Ayurveda relies more on a holistic assessment, looking at the whole picture, observing the symptoms, and seeing how they fit with the classic descriptions of doshikakasa and tabakashkasa.
Those are the advanced stages of cough and breathing difficulty we talked about earlier.
Right, so it's more of a pattern recognition approach.
Okay, so more individualized.
Yes, very much so.
Okay, before I move on to management, I think it's important to talk about complications. COPD can lead to some pretty serious health issues, right?
Unfortunately, yes, it can increase your risk of respiratory infections like pneumonia and bronchitis. You can have a pneumothorax, which is a collapsed lung. Unintended weight loss can be a problem. Pulmonary hypertension, that's high blood pressure in the arteries of the lungs.
Right.
And then there's chronic cor pulmonale, which is when the right side of the heart is strained because of the lung disease, and that can eventually lead to right heart failure.
So COPD can really affect the whole body.
It can. And the article points out that Ayurveda also recognizes these kinds of secondary complications. They call them upadrava.
Okay, so both systems acknowledge that COPD can have a ripple effect on other organs and systems.
Exactly.
All right, well, that's a good segue into management because I know our listeners, especially those who are dealing with COPD themselves, are going to be really interested in what Ayurveda has to offer. So, how does Ayurveda approach managing this condition?
It's really a three-pronged approach: Nidana Parivarjana, Shamana, and Shirtana. And those are,
Avoiding the causes, pacifying the symptoms, and biopurification.
yes, you got it.
Okay, so let's break those down. Starting with avoiding the causes, we've already talked about the potential triggers, but what does that look like in practice?
Well, first and foremost, if you smoke, you need to quit. There's no way around it. And if you're exposed to dust, fumes, or chemicals at work, you need to take precautions: protective gear, proper ventilation, that kind of thing.
Right, minimize exposure as much as possible.
Exactly. And be mindful of contact with people who have respiratory infections. And try to avoid extremes of temperature, cold weather, high altitudes, anything that you know triggers your symptoms.
So it's about being aware of your individual triggers and doing what you can to avoid them.
Yes. And Ayurveda also emphasizes avoiding daytime sleep.
That's interesting. Is there a reason for that?
They believe it can increase kapha, which we know is already a problem in COPD.
Okay, so it's about keeping that dosha in check.
Right.
What about lifestyle changes? What are some of the recommendations?
Well, regular exercise is important, but not anything too strenuous. Gentle exercise that you can sustain. And a healthy diet: fresh, warm foods, easy to digest, low in saturated fat, lots of fruits, vegetables, whole grains.
Pretty standard healthy eating advice.
Yeah, it aligns pretty well with modern recommendations. Maintaining a healthy weight is also important, and making sure your living environment is well ventilated and clean.
Good hygiene. Makes sense.
Absolutely.
Now, are there any specific Ayurvedic practices that are recommended?
Yeah, one that's often mentioned is nausea, which is basically putting a couple of drops of medicated oil into your nostrils.
Oh, I've heard of that.
It's thought to lubricate and protect the nasal passages, so they're less vulnerable to irritants. They recommend using either Anutila or Shibindutila.
Interesting. Any other specific practices?
They really emphasize having a regular daily routine: waking up early, drinking warm water on an empty stomach first thing in the morning, and eating meals at regular times. Again, it goes back to keeping the digestive system functioning well.
Right, that seems to be a recurring theme.
It is.
And diet seems to be a big part of the Ayurvedic approach. Are there specific foods that are recommended or discouraged?
Yeah, there's a whole list. They recommend foods that are pungent, salty, hot in potency, but also unctuous, meaning they have healthy oils, and light, easy to digest. So things like gourd, bottle gourd, spinach, fenugreek, garlic, ginger, bitter gourd, pointed gourd, drumstick,
Wow, that's a lot.
and pulses like mung beans and horse gram.
Okay, so a pretty wide variety of vegetables and legumes. What about foods to avoid?
They advise against excessive tomatoes, cauliflower potatoes, rice flour preparations, sweets, curd, whole milk, black gram, coconut oil.
So basically things that are heavy and hard to digest.
Right. And fermented or sour foods, cold drinks, and refrigerated food.
Interesting. So they really emphasize fresh, warm food.
They do.
Okay, so we've covered avoiding the causes and lifestyle changes. What about shatana, those bio-purification therapies?
So these are more intensive procedures, and they're not for everyone. The article says they're usually recommended for people who are strong enough to handle them, and ideally they're done at certain times a year.
Okay,
So there's vamana, which is therapeutic vomiting,
okay.
virchana, which is a therapeutic bowel cleanse, niruhabasti, a type of enema, and nausea, which we already talked about. The idea is to eliminate excess kapha, especially from the respiratory tract, and dry up that mucus.
So it's like a deep cleanse for the system.
Yeah, you could say that.
But definitely something you'd want to do under the guidance of a qualified practitioner.
Absolutely. Not a do-it-yourself project.
Right. Okay, so that's shatana. What about shamana, the pacification treatments?
This is where the medications come in. And Ayurveda has a whole arsenal of herbs that are traditionally used for respiratory problems.
Like what?
Well, ginger, cardamom, turmeric, those are some common ones.
Okay, those are familiar.
Then there's trikapu, which is a combination of three peppers, papali or long pepper, ushwagandha, agnamatha, Ashmoda, Ajaji, Guduchi, and so many more.
Wow, that's a long list. I'm not even going to try to remember all of those.
Don't worry about it. The point is that there are a lot of different herbs that can be used depending on the individual's needs.
Right, so it's very personalized.
Exactly. And they often combine these herbs into specific formulations.
Like what?
Well, there's Kafkitarasa, Gujihabhikvata, Dashmulakarata, Chitraka, Harataki, Avleha. And those are just a few.
So it's not just about taking a single herb, it's more like a symphony of herbs working together.
That's a good way to put it. And the article also mentions Rasayana therapies.
Rasayana.
These are rejuvenative therapies. They're meant to promote overall health and vitality. And in the context of COPD, they're thought to strengthen the respiratory system.
Okay, like building up the body's defenses.
Exactly. So things like Papali Rasayana, Trivanaprasha, Agasti Haritaki, Vyagri Haritaki, Haridrukanda.
Those are all pretty unfamiliar to me.
They are specific Ayurvedic preparations, but don't worry, we're not going to get into the details of each one. Just know that they're there.
Okay, good to know. And finally, the article talks about yoga and pranayama. How do those fit into the management of COPD?
So pranayama is conscious breathing, and it's a key practice in yoga.
Right, I've done some pranayama before.
It's incredibly beneficial for respiratory health. Specifically, techniques like Tapalhati, that's the skull-shining breath. It's thought to purify the nadis, which are energy channels in the body.
Oh, interesting.
And any kind of controlled breathing practice can help improve lung function. It strengthens the respiratory muscles, increases lung capacity. And the article even suggests that pranayama and meditation can help regulate the autonomic nervous system.
That's the system that controls all the automatic functions of the body, right? Breathing, heart rate, digestion.
Exactly. So it might help relax and dilate the bronchial passages, which could be especially helpful during an asthma attack.
Wow, so pranayama can have a pretty profound effect on the body.
It can. And then there are specific yoga postures, asanas, that can also be beneficial.
Like what?
Things like Kujanasana, the cobra pose, Savasana, which is just lying flat on your back, Shalapasana, the locust pose, and Paschimottanasana, a seated forward bend.
Okay, so those are all postures that open up the chest and improve lung capacity.
Exactly. They help improve blood circulation in the lungs, too.
So it's all about supporting the respiratory system.
Right.
Okay, well, that was a pretty comprehensive overview of the Ayurvedic approach to COPD management. It's pretty impressive how many different tools they have in their toolbox.
It is. It really emphasizes a holistic approach, addressing the underlying imbalances, not just the symptoms. And it empowers individuals to take an active role in their own healing.
Exactly. It's not just about taking a pill. It's about making lifestyle changes, modifying your diet, incorporating practices like nasya and pranayama. It's really about cultivating a healthy lifestyle.
That's a great way to put it.
So to sum up for our listeners, COPD is a serious condition, and it's becoming more common. But both modern medicine and Ayurveda have valuable insights to offer. Modern medicine gives us a clear understanding of the physiological processes involved and how to diagnose and manage the condition medically. And Ayurveda gives us this whole other perspective, focusing on lifestyle, diet, herbal remedies, and practices like yoga and pranayama. It's not about choosing one over the other. It's about seeing how they can complement each other.
Right. I think that's a key takeaway.
Absolutely. And the beauty of Ayurveda is that it really empowers people to take charge of their own health, to make changes that can not only manage the symptoms, but also address the root causes.
And potentially prevent the condition from developing in the first place.
Exactly. Prevention is always better than cure.
Always.
So this deep dive has given us a lot to think about. And for our listeners who are interested in learning more about Ayurveda and how it can be applied to their own health, I encourage you to do some research. There are so many resources available these days.
There are. And don't be afraid to reach out to qualified practitioners. They can help you personalize these principles and practices to your individual needs.
That's great advice. And I think it leaves us with a really interesting question to ponder. Given what we've learned about both modern medicine and Ayurveda, what are the possibilities for integrating these two systems? Can we take the best of both worlds, combine conventional treatments with lifestyle changes, dietary modifications, and maybe even some of these Ayurvedic practices? Could that lead to a more holistic and effective approach to managing COPD and other chronic health conditions?
It's a great question, and one that deserves further exploration.
I think so too. So for our listeners, we're leaving with that thought, the potential for bridging these two worlds, combining the wisdom of the past with the knowledge of the present, and creating a truly integrative approach to health and well-being. Thanks for joining us on this deep dive.
It's been a pleasure.